Hello, hello. This is Jonathan Munoz, and today we're going to talk about behavioral questions. A couple of behavioral questions. One of them is tell me about a time that you work under pressure. And the second one is going to be tell me about something that irritates you from others and how you deal with it. Simple behavioral questions, it shouldn't be very difficult to respond or to answer, but keep in mind that the answer should be thoughtful and should be something that they could relate to in order to assess if you could be useful for us, if you're ready to work. So, for the first question, let's say you get asked, tell me about a time that you had to work under pressure. The best example that you could give is about a time that you had to deal with a critical ill patient and you were under pressure from family members, from consultants, and you didn't know initially what to do. You were overwhelmed, and you felt this was a very high intensity, very um, determinant time in your career that you had to do something, and therefore you were under big pressure. So let's say, for example, me. When do I find I'm under pressure? When I'm dealing with a very critical ill patient that needs, basically, it needs organization or pure organizational skills, commitment, empathy, and coordination of care. Let's say I go to the ER to admit a patient that has sepsis and UTI, and very sick patient, hypotensive, febrile, encephalopathic, poorly responsive. The family is at bedside, and I'm doing my assessment. And I think, okay, blood work points towards sepsis, lactic acid is very elevated, blood pressure is trending down. So I start thinking septic shock. He will need ICU care. He is probably right now in the brink of death if I don't do something. So first things first, life-saving measures, antibiotics, fluid resuscitation, and if need of vasopressor therapy, vasopressor therapy. Second step will be to talk to the family. I will tell them, hey, um, this is what we're facing. Your mother is not very responsive right now. We're gonna give treatment with fluid therapy, antibiotic therapy. We're thinking that we're dealing with a very strong urinary tract infection. So she is going to the ICU to continue her care there. So that's the second step. Inform the family of what is going on and what is your proposed plan for that patient. Then you relieve one of the stressors, the family. The family is expecting you to do something, so you relieve them by saying, what's your treatment, what's your plan, and what's coming next. Then there's pressure in you because you are still dealing with a very sick patient that needs more therapy, more possible need for intensive care therapy like vasopressor therapy, intubation if needed. So your work hasn't ended there. You still have to coordinate care. You still have to consult an infectious disease specialist if you think this patient is very septic, like this one we're talking about, or the intensive care unit doctor and say, hey, um, I'm gonna send. I would like to send this patient to the ICU because she is very hypotensive and she's elderly. She has a UTI. I think on her condition, at least 24-hour monitoring in the ICU will be appropriate. Hopefully, she doesn't go into respiratory failure and needs to be intubated. So now you communicated your plan to the intensive care doctor. Now you can feel relieved. You can feel that pressure has improved because not only you have a plan, but you have a backup plan. You are sending him to the ICU to continue um, the intensive monitoring that you are thinking this patient needs. So that will be a situation that you're put under a lot of pressure from family members, from yourself on, you know, thinking or developing a plan. But what did you do to deal with the pressure? You identify the the pressure sources, you identify the stressor sources, and start working on each of them, prioritizing life-saving measures in your patient, prioritizing the patient. So you prioritize the patient. That's your strategy. How you dealt with this? You you talk. I don't know. You could say you. I put in my mind that I have to prioritize what is important, what is life-threatening, and then tackle the other stressful sources. So you prioritize by treating the patient, and then tackle the other sources by talking them, creating realistic expectations, creating a treatment plan, and explaining it to them. And what did you learn? So at the end of the day, you learn that in situations that you are under pressure, it's important to have a clear mind of what is important, what is at stake, and how can we help the whole situation by working with all these stressful sources around this, like the family, the need for intensive care work, or the need for coordination of care. And that's something you learn. You learn organization skills. See, this is a very good example because it's not you're not um, pointing fingers at anyone. Like people will say, "Oh, sometimes one time I was under a lot of pressure from my attending, and I didn't think it was right from him to ask me all this, so I complained to someone else, and then I studied more, so he didn't put more pressure on me." So that wouldn't be a good explanation, a good answer, because you're putting pointing fingers. You're not owning the situation. You're not taking the situation into your hands. Okay, so that's the first one. The second one is we said, let me check here my little question bank. Oh yeah, tell me about the time. Tell me about things that irritate you from people, and how do you deal with them? So, for example, for me, and when you give this example, you have to give something that is um, a situation that they can work, they can relate with. For example, for me, it really annoys me when I go to a nurse's station or I see people in the hallways outside the patient's room laughing and having a good time, being loud, and I cannot avoid stopping and saying, "Hey, could you take your conversation to a more private room, to your lounge, to your break room?" Because I think I have to intervene in these situations because we're dealing with very vulnerable patients in their rooms, trying to rest, trying to consolidate ideas of what their treatment process is, trying to communicate with their family members. Maybe some of them dealing with the end of life, and people are laughing and talking and having a good time outside the room. I don't think it's right. So I wouldn't want my family members to undergo that situation. So it's on me to talk to the people I see doing this and very gently, very kindly ask them to please take this conversation to a different room, to a different area where there are not patients. And so that's one thing the trick to this is that you have to be respectful of whatever annoys you from people, and whatever annoys you from people cannot be something that is very difficult to work with. For example, I don't know, personality problems. Um, I would say something like this in these lines is very common to find in hospitals, and that you can take action and be considered a leader and a good person to do this is taking action on situations like this. So those are my two situations I wanted to give you advice on, and I'm very happy with this frame and this new computer I bought. The resolution is great, so I'm hoping the sound will be good too. So if you want to know, this is the newer MacBook Pro 14-inch with 16 gigabyte memory unified, and the new microchip is I like the image resolution, so I'm very happy with it. Hopefully my videos will look more and more professional now. So good luck, guys. I'm going to post some of these questions, behavioral questions, for you on the Facebook group, but please subscribe to the channel and pass it on to people that might go into interviews this season. Thank you.